Here we are talking about the relationship between trauma, stress, and addiction. In this context, trauma is an emotional wound. And when somebody experiences an emotional wound, if it's not resolved, they will move forward in life having a relationship to that wound. They'll be in their present moment relating to something that happened in the past. Maybe they're in a new relationship, and that new relationship is triggering something that was hurtful or harmful in a past relationship. That will build stress in the body, stress in the nervous system. That stress is a relationship to that wound. It's a relationship to the trauma. Think about a broken leg. When I was a young kid, I broke my leg and it was either not attended to or it was set improperly. And I grew up with that leg not healing correctly. I may have a limp. And that limp is not the broken leg, but that limp is my relationship to the breaking, to that trauma that happened, even if it was many, many years ago. And that limp may inform how I walk or don't walk, how I run or don't run, how I participate or don't participate in life, how I think about myself and my place in the world. And that relationship to that trauma, that relationship to my history becomes stressful, and it becomes stressful in the present moment. When stress gets big enough and even grows to the point of being chronic and painful, we seek relief. And that's where addiction comes in. Addiction can be a loaded word. People think of drugs or alcohol, and those are forms of addiction. People also seek relief in all kinds of other ways. Sex, food, work, exercise, gaming, gambling. Some of these things are part of our daily lives that are even helpful. But when they're used in a way that's out of balance and become the most important thing that one needs to do, they are used in an addictive nature. When it becomes the thing that someone has to do just to feel normal or to get by, we would classify that in this way as a form of addiction. And sometimes we can use things addictively that on one day, maybe we're using them in a normal manner, and another day we're not. The question often I like to ask people is when they're asking me if they're addicted to something is, does it have you or do you have it? The question I often like to ask people if they're asking me if they may be addicted to something is, do you have it or does it have you? But in this case, addiction is not the problem. It may become problematic because it's taking away from your life, but addiction is the solution. Addiction is the solution to the stress one is experiencing, and that stress is the relationship to the wounding that they experienced. And so this becomes a cycle. Trauma, stress, and addiction. And while it may start with a wounding, after this cycle starts, if you add more stress, someone's going to look for more relief. If someone's finding relief in an addictive manner, that's going to traumatize themselves. It may be a physical trauma to their body or a trauma in how they are in relationships or to the people that they surround themselves with. And so this becomes this cycle that almost doesn't stop until there's some sort of intervention, until someone's able to put down the addiction, find some capacity to deal with the stress that they're experiencing, and then dive in and do some work to resolve the emotional trauma that they have experienced.